Good morning. I am Captain Heather Damaris, Director for the Office for the Advancement of Telehealth and the Health Resources and Services Administration. I am excited to be here to kick off the National Telehealth Conference, supported by the Department of Health and Human Services, Health Resources and Services Administration, also known as HRSA. We are here today following the growth in telehealth in the past 3 years. And the COVID-19 pandemic shifted the way we do telehealth and really caused our healthcare systems to incorporate telehealth into our healthcare delivery. So HRSA's priority is to better understand now how telehealth services are being integrated into the standards of care and to share best practices and increase access to healthcare, improve health outcomes, and improve health equity. During today's conference, you'll learn more about these areas from public and private sector telehealth leaders. So, as many of you may know, but some of you may not, HRSA has a long-standing commitment to telehealth with over 35 years of experience. And in 2020, we saw a tremendous increase in telehealth utilization during the pandemic. For example, beginning in 2020, over 99% of HRSA-funded health centers have offered telehealth services. And telehealth.hhs.gov has served more than 5 million users since its launch in 2020. Also, HRSA's telehealth resource centers were a great asset. They were able to respond to over 6,000 telehealth technical assistance requests. Through millions of dollars in funding across our programs at HRSA, we are working to increase access to healthcare through telehealth technology. HRSA's awards use telehealth to strengthen the healthcare workforce, to support the provision of behavioral health and maternal health services, to directly link patients in rural and underserved communities to healthcare services and resources, as well as to conduct clinically informed research. So HRSA does disseminate the latest information about telehealth to providers, patients, and other stakeholders through telehealth.hhs.gov. And HRSA's Office for the Advancement of Telehealth serves across the department to coordinate with key partners in expanding and improving health outcomes through telehealth. So while in-person healthcare has returned, HRSA continues to empower healthcare providers and patients to deliver and receive care using telehealth technology when it can improve access to quality healthcare services for the patient. So telehealth provides many benefits and allows us to extend quality healthcare to individuals, including those living in rural or underserved areas where there may be fewer clinicians available. Telehealth can also support patients in ways such as decreasing patient travel, especially for those who may have difficulty with accessing transportation. And we have seen significant changes in telehealth related policies throughout the past 3 years that provide us an opportunity to continue to improve access to healthcare through telehealth services. So while we've seen a large increase in telehealth use, as I've shared, work still needs to be done to address health equity and ensure greater access to telehealth. For example, the telehealth utilization is lower in rural communities compared to urban communities, as well as lower among families with low incomes compared to those with high incomes. It is promising that patients and providers have embraced telehealth and want to continue to use the technology as part of a hybrid model of care that can combine in-person care with telehealth services in order to increase access to quality healthcare services. Optimizing and fully integrating telehealth into the standard of care is our next great opportunity to improve access to care, especially those for rural and underserved populations. HRSA does continue to support telehealth to improve access to care. It is something that we, and really all of us here today, have the opportunity to partner on and work together. So before we get started with the conference today, I am very excited to share with you pre-recorded remarks from a few of our congressional members, sharing their thoughts about the importance of telehealth, as well as some of the work being done in Congress to support telehealth. First, you'll hear from Representative Bill Johnson of Ohio. Representative Johnson is one of the co-chairs of the Congressional Telehealth Caucus. Next, you'll hear from Representative David Schweikert of Arizona, also one of the co-chairs of the Congressional Telehealth Caucus. And the third set of remarks will be from Senator Peter Welch of Vermont, who is also one of the co-chairs and a co-founder of the bipartisan. The remarks will highlight the importance of reaching rural and underserved populations through telehealth. But before we start the video, I'd also like to acknowledge the support of Senator Brian Schatz of Hawaii. He was planning to provide pre-recorded remarks for today's conference, but he needed to shift his focus to the horrific wildfires in Hawaii last month. My thoughts are with all of those who were impacted. And now it is my pleasure to begin the video so that all of you can hear from a few of our members of Congress.
Hello, friends, and thank you for your strong support and advocacy for telehealth and the invitation for me to speak with you today. I'm Congressman Bill Johnson, and I represent Ohio's 6th Congressional District, which is comprised of 11 full or partial counties across Eastern Ohio. I'm really delighted to speak with you about an issue that I know we all care very deeply about. And let's be clear, this is not one of those issues that fall along the typical partisan divide. I know there are Republicans, Democrats, and independents here today. We all know the importance of telehealth for everyone. Your political affiliation or leanings don't really matter. It's been a pleasure working with stakeholders and lawmakers on both sides of the aisle as we advance telehealth priorities. Now, I don't need to tell you about the devastating effects of the COVID pandemic. We all lived it, and some aspects of our lives were changed forever. There was, however, a silver lining that emerged from all the wreckage, and that was the rise in awareness and use of telehealth services. The pandemic isolated individuals and made them unable to receive health care. But in Eastern Ohio and across parts of rural America, isolation can be the reality even in normal times. For some, there is no provider they can see nearby in person. And if there is, it often requires setting aside an entire day for travel. I've heard from patient after patient and provider after provider who took advantage of these safe new telehealth services, both during and after the pandemic. They love the convenience and immediate access that telehealth services provide. They told me then, and they continue to tell me today, they do not want to go back to the way it was before. It's time for Congress to make access to telehealth permanent for the American people. Here's a stat you may not know about. We held a hearing in June of 2020. At the hearing, we were told that during the week of January 15th, 2020, before the COVID pandemic began, there were only 500 telehealth visits by Medicare patients across the country. But by the week of April 15th, 2020, at the start of the COVID pandemic, there were some 150,000 of them. This is proof that cutting back Washington red tape really does make a difference. There's no doubt about it. The coronavirus presented a unique set of challenges for healthcare officials and patients around America. And telehealth played a major role in the solution. Study after study demonstrates that the use of telehealth to furnish healthcare services is beneficial for quality of care, access to care, and reduced spending. However, to keep the ball rolling in the right direction, we must continue removing some of the barriers that limit the use of telehealth. There are two pieces of legislation I'm working on right now that I want to tell you about. HR 4189, the Connect for Health Act, would permanently expand access to telehealth services, ensuring that Medicare beneficiaries can continue to receive essential care that has become a key component of their health care. Permanently extending this type of telehealth coverage will benefit both patients and physicians, continuing to build on the progress made since the onset of the COVID pandemic. Additionally, HR 3432, the Telemental Healthcare Access Act, would take permanent steps towards eliminating the burdensome in-person requirements for Medicare beneficiaries receiving mental health care through their telehealth experience. Access to telemental health care has reduced burdens for Medicare recipients to access mental health services, especially for those living in rural areas or other mental health care type deserts. This legislation would ensure that we're not hindering patients' use of this technology by creating barriers such as an in-person evaluation 6 months before initiating telemental health services and every 12 months while receiving telemental health services. The extension of the Medicare telehealth waiver passed at the end of last year delayed these requirements. The Telemental Health Care Access Act makes certain that they are never implemented. I'm going to continue to be a champion for telehealth. Please know that my door is always open to you. If you have an idea or suggestion, please let me or a member of my staff know. Hey folks, thank you for the opportunity to speak with you today on this very important topic, and enjoy the rest of the conference.
Well, first, thank you for participating. For the administration, for those of us who have an intense interest in telehealth, I actually wanted to challenge all of you. What's telehealth? Is telehealth FaceTime, or is telehealth the data coming off your watch? Or is telehealth the access to remote health? Is it the thing you can blow into in your medicine cabinet that can instantly determine you have the flu? Is telehealth the technology underneath that should it be allowed to order your antivirals? Should it be allowed to write a prescription? The fact of the matter is all those things do exist today technology-wise, but the rule sets, the reimbursements, even some of the state statutes and federal statutes don't allow it. What is the future of telemedicine? Enjoy the conversation.
Hello, I'm Senator Peter Welch, and thank you to the Health Resources and Services Administration for giving me this opportunity to speak to you about the importance of telehealth. Big challenge, improving access to healthcare. That's crucial. It's especially a challenge in rural states like Vermont. The nearest doctor is miles away, specialists are even further, transportation can be a real hassle. Telehealth is a tool that can increase the health of patients, especially for folks in underserved communities. You know, before COVID, we were making an argument about the viability of telehealth. That argument dissolved in COVID because many people couldn't even see a physician or a provider except through telehealth. It worked, and the relationship between the provider and the patient was very intimate. Now, the worst of the pandemic is behind us. There were restrictions that we pushed aside during COVID. We really can't let them come back because the telehealth is a proven method of getting good healthcare services to everyday people throughout our state and throughout our country. So I look forward to working with you and our many partners to make certain that we preserve the benefits of telehealth for the people we serve. Thank you.
All right. So for those of you who may have just joined, we did just hear from a few of our members of Congress. So thank you, Representatives Johnson and Swikert, as well as Senator Welch, for sharing those messages with us on the important role that telehealth fills in reaching rural and underserved populations. Telehealth really is a tool that can improve the health outcome for patients. So moving on to give you a quick overview of the day, I really thank everyone for joining us virtually today. I was so excited to see how much enthusiasm and registrations we had for the conference. There really is a lot of interest in this topic across the country, and we are excited to be able to host this conference leading up to National Telehealth Awareness Week, which is September 17th through the 23rd, next week. This is a time when national and regional events take place to focus on the role of telehealth in care delivery and share the most recent educational resources. To find out about ways to participate in the week, go to telehealth.hhs.gov and look under the events section. So today you'll hear from several federal leaders and telehealth experts on how telehealth services are being integrated into care. First off, we're going to begin with the HHS session, Leading the Way, in which we'll hear from HHS leaders HRSA Administrator Carol Johnson and CMS Deputy Administrator Dr. Meena Seshamani. And following that discussion, we'll also hear from private sector leaders sharing about their work and what their organizations are doing to improve access in underserved communities. We know that access to the internet is essential for improving access to telehealth and broadband services. Commissioner Carr of the Federal Communications Commission will lead our discussion on this topic. And we'll also have speakers from other federal agencies, including the National Telecommunications and Information Administration, as well as the U.S. Department of Agriculture. Then we'll hear from leaders on using telehealth to strengthen the healthcare workforce and expanding services for patients. We will also discuss telehealth's role in behavioral health access and outcomes, and the integration of behavioral and physical health services, particularly for underserved communities. And then we'll end the day with telehealth trends and research to highlight recent telehealth research findings. Really, within the past few years, we have seen a tremendous amount of passion from individuals in the field of telehealth, many of whom are here with us today. There is an excitement about the opportunities of telehealth within healthcare and a mirrored passion within the federal government of telehealth and broadband experts. These experts have joined together, breaking down silos to ensure access to healthcare through telehealth services. So HRSA will continue to count on telehealth to help us improve access to care and advance health equity. We know that it will take us working together on issues such as broadband access and addressing social determinants of health to deliver healthcare equitably to people that need it the most. I hope you all enjoy the sessions today. We are at an exciting junction in telehealth, and I encourage you to see the importance and promise of this technology and look for innovative ways to integrate telehealth into healthcare to improve health outcomes for patients and communities. I would also like to acknowledge the leadership and staff members who are part of the HHS Telehealth Work Group, the HRSA Telehealth Work Group, and of course, I also want to thank the leadership and staff within the Office for the Advancement of Telehealth, which I oversee, in particular, Stephanie Miller and Lieutenant Commander Jenna Cope for their leadership in organizing this conference. So I just have a few housekeeping items to go over before we transition to our next session. As we look forward to the day, just a few reminders. The conference agenda is located on the conference website and can also be found on telehealth.hhs.gov. The sessions today will be hosted on Zoom. And to join each of the sessions, please just visit the agenda online where you'll see a hyperlink under each session title. It'll say click here to join, so you just click and you can go to the next session. And we are also recording each of the sessions today, and they will be posted online in the coming days, and you'll be able to view them on demand. So transitioning to our first session, it is now my pleasure to introduce Leading the Way in Telehealth, where HRSA Administrator Carol Johnson will moderate the session with Dr. Meena Seshamani, Deputy Administrator and Director for the Centers for Medicare and Medicaid Services. And at this time, I would like to invite you to navigate over to the agenda and select Click Here to Join, like I just mentioned, under the Leading the Way and Telehealth session title. Thank you again, and we hope you enjoy the conference.